Post-traumatic stress disorder, or PTSD, occurs in some people exposed to extreme events outside of the normal human experience. Examples include exposure to death, serious physical injury, or sexual violence. The development of PTSD from certain events depend on age, prior psychiatric disorders, and level of social supports. PTSD affects 7% of the general population. Most men with the disorder have experienced wartime combat, while women are more commonly affected by the precipitating stressor of physical or sexual assaults. PTSD can occur at any age from childhood to old age. PTSD can occur immediately following the traumatic event or months to years later and presents with the following symptoms: recurrent involuntary and intrusive distressing memories of the traumatic event in the form of dreams or flashbacks, dissociative reaction to the memories, which the individual feels as if the traumatic event were occurring, ranging in severity. The extreme reaction would be complete loss of awareness of the present moment. Disassociation can be presented as depersonalization, where an individual may feel as if they are detached from oneself and feeling like they are in a dream, and derealization, feeling like the world around them is unreal. Intense psychological distress or physiological reactions to exposure of cues that resemble the traumatic event. Avoidance of, or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event, and external reminders such as people or places. There may be negative changes in cognition or mood, making an individual unable to remember the event due to dissociative amnesia, negative beliefs about oneself, feeling detached from others, and not able to feel positive emotions. The individual may also have alterations to their arousal and reactivity characterized by irritability with outbursts of anger toward people or objects, self-destructive behavior, being hypervigilant, problems with concentration, and sleep disturbances. Brain imaging of individuals with PTSD show reduced hippocampal volume and increased activity in limbic regions, particularly the amygdala, and may help to explain the role of disturbed emotional memory. Treatment includes SSRIs to decrease depressive symptoms, reduce nightmares and flashbacks, and normalize sleep. Other interventions include short-term use of benzodiazepines for anxiety, prazosin for nightmares, and cognitive behavioral therapy to help control dysfunctional thoughts and anxiety.